Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Health insurance in today's world is a must, but understanding your health plan and what it does and doesn't cover can be confusing at best. If you're one of the many whose eyes glaze over at the mere mention of health insurance, wipe those eyes and stay tuned. I'm your host, Janet Whitmoyer, and today we're here to help you understand your health plan, because the best way to save money on your health care is to get the most out of your insurance. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. Stay tuned. Welcome back. Joining us this morning is Meg Jacoby. Meg has over 25 years of health insurance experience. She's licensed in Montana and understands the nuances of the life and health insurance markets. Meg, thanks for being with us this morning.
Thank you for inviting me.
Absolutely. I want to start off with a question about the people who are under the age of 65 who might be thinking of retiring early. And what they should really be thinking about as far as health insurance plans go.
When they're under age 65 and they're thinking of retiring, there's many different things they should be looking at. Do they have COBRA eligible to them? What is the cost? Have they already met their maximum out-of-pockets and deductibles? Or is it better for them to maybe look at an individual policy? They can either go direct to the company or they can look through the healthcare.gov and the federal marketplace.
Okay, so for the folks that are under 65 that might have a plan through the marketplace or some other type of insurance, what happens when they turn 65? Do they lose that plan, or how would that work?
They can actually keep that policy. However, most people find it financially better for them to come off the individual policy when they're first eligible for Medicare and go on to a Medicare plan. It could be original Medicare paired with a supplement and a drug plan, or they could do a combo plan like a Medicare Advantage plan. But they can come off the month, at the end of the month prior to their Medicare effective date.
Okay, that's good information for them to know. So going back to the insurance marketplace, you brought that up. How would people go about enrolling or getting a plan in the marketplace? What would be the first thing that they should do?
Well, the first thing I would recommend is that they find somebody to help them with the process if they're not comfortable doing it on their own.
Okay.
When they go on to healthcare.gov, they can look at all the plans that are out there and eligible to them. Okay. If they work with either an agent, a navigator, or a certified assister, they can also help them with that process, because there's many different nuances that go into it.
Okay. So you brought up the agent and the assister ideas. If somebody needs that help, what can those people actually do for them to get a plan? They
help them identify what is needed to do the application on healthcare.gov, because they need everybody who is in that household has to be on that application, which includes the names, the date of birth, social security numbers. Income also is a big factor in that, because you have to include everybody on that tax income for that household to go onto that application to determine if they're eligible for a subsidy with the healthcare.gov, or if they would be then paying full price. Or in some cases, they might be eligible for Medicaid.
So even if somebody really has a plan and they like it, it might be a good idea to find somebody to help them, because it might change and they might have to provide more complicated information.
Yes, correct.
So how would somebody go about finding an assister or an agent to help them?
They can go onto healthcare.gov, and there's a place on there where they can actually locate to find an agent or an assister. The assisters are in the healthcare facilities around. A lot of doctors' offices and the hospitals provide that. Navigators they can find around as well. And agents, they can go directly to the company and ask who is out there who is also doing individual coverage, because not all agents do individual coverage anymore.
Okay, so once a person has found somebody to help them with that, what would you recommend that they do to prepare for the meeting with somebody like you or an assister?
Gather up all the information that they are going to need for that meeting, to include how much they have spent out of pocket today, in their current plan because it may be better for them to stay on COBRA if it's available to them. But they also want to compare going on to healthcare.gov, and they will need all that information about their household, dates of birth, the names, the social security numbers. That all has to be input into healthcare.gov to calculate if they'll get a subsidy or not, or be eligible for Medicaid.
Okay, so once they've got all that information and you're helping them to look for a plan, can you tell us a little bit about the differences of what they should actually be looking for in a health insurance plan?
Well, there are actually 4 different levels of plans through the healthcare.gov and direct on the marketplace. There are your platinum, gold, silver, and bronze. They all determine what is eligible for them in the benefits. Platinum is the richest, which means it has the lowest out-of-pocket cost to the person. Bronze is the least expensive,
Okay.
or least expense out of the person's pocket.
Oh, okay, that's good clarification. So when they've gone through all of this and they've decided that on a plan, is there a certain time that they can sign up or enroll in these plans, or can they do that at any time?
They have to enroll during the open enrollment window unless they have a qualifying event or a life trigger.
Okay.
So the open enrollment window goes from November 1st through December 15th every single year, no matter what day of the week it falls on.
Okay.
Now, if they have a life trigger or a qualifying event, which could be moving in or out of state, married, divorced, had a baby, just lost coverage for some reason other than I didn't pay my premium, those would be a life trigger that they could then go on to the healthcare.gov or apply for a plan.
And you could help them if they felt like they had one of these life triggering events to work through that whole problem.
Yes. Now they have to provide proof of that triggering event.
Okay, perfect.
Within 30 days of applying, and if they don't provide that proof, their plan that they apply for will become null and void.
Okay, great information. I would like to take a pause here for a short break, and we'll continue this conversation after these messages. Stay tuned with us as we learn about what health plans cover and explain all of the confusing insurance terms. We'll be back.